Short, so here I go. I don't claim to be an expert on any of this. Most of what I'm going to share with you today is kind of through trial and error with our personal story with ECD. And one of the things that I've enjoyed the most so far about this conference, and there are a lot of things that I've enjoyed about it, but is hearing everybody's stories and how varied they are. But yet there's that similar thread running through them, but they're also different. So again, most of this probably is not new to most of you. Oops. Okay, oops, sorry. Blah, 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 blah,
Please,
blah.
I'm sorry.
It's fine. We'll blame it on Dr. Estrada.
There you go.
Okay. So this is just something I happened to find up on the website that was just kind of a nice, it looks like a pretty scene. But to effectively communicate, we must realize that we are all different in the way we perceive the world and use this understanding as a guide to our communication with others. In maintaining solid communications, communications is giving and receiving information. Nowhere is this exchange more important than your relationship with your medical professional. Expressing your health needs and concerns and getting answers to your questions are key components of effective communication in the healthcare setting. Just to let you know a little bit more about me, again, I am a registered nurse, did go to college in southern Mississippi to become an RN. I've worked in the hospital and a medical office, and I'm currently a teacher at the high school level where I teach medical science. Interesting little thing I just found out, one of the other patients that we just met from Florida, I work with her nephews. Like, how weird is that? So she was mentioning who her nephews are. I'm like, I work with them at the same school. And hi, Michael, I hadn't met you yet, but hi. I know Brian and Chris. That's so cool. So you never know who you're going to meet. And I am a caregiver. My husband has been diagnosed with ECD since 2009. With any communication, I don't care what type of communication, there are goals, but the main goal particularly that we're looking for with taking care of our patients is to better take care of our patient and our loved one, less stress for the caregiver, and also less illness for the caregiver as well, because statistics show that if you're caring for someone else, you're more likely to become ill yourself if you're not taking good care of yourself. More efficient use of everyone's time, and more satisfaction for all concerned. A lot of the information that I gathered, I did gather from medical professional friends of mine, from the physicians that take care of my husband, and getting some feedback from them as things that they wanted. So I have kind of surveyed the internet and RNs and doctors along the way. I'm going to be using the 4 parts of communication, of course, the sender, the message, the receiver, and feedback. For the sender, I'm going to consider that's you. You, the caregiver, you, the patient, and the receiver is going to be the medical professional, which I chose to abbreviate MP. Okay? So whether that's the RN or the doctor or whomever. The message, of course, is whatever information you're trying to get across, and feedback is making sure that what you were trying to get across, you did get across. So first, I'm choosing to focus on the sender. Collectively, I know we probably all have so much to share, and one of the things that I think we enjoy the most is sharing with each other what's worked, what didn't, who to contact, how to contact them, how to word it, and those types of things. So together, again, at this type of conference, we're able to share those things, and I'm sure we probably all have a lot of those, I wish I'd known then what I've learned now. But just in case there's someone who may be more junior in this journey than my husband and I, we're going to just kind of share with you some of the things that we've learned along the way, and maybe it would make your lives a little bit easier in learning from us. But I know a lot of us have things that we could share, and we could probably write a book on it. I don't know who'd buy it, but we could probably write one. One of the main things that you need to do, of course, is to keep a log, and one of the most important things is to know who to reach for what. I mean, do you talk to Becky when you need the refills? Do you talk to Judy when you need the appointments? Those are the types of things you need to know. Most medical offices do have some particular one person who's in charge of one particular thing. Make sure you know who that person is and how to contact them. Paper pencil still works. It's very low tech, and you can put it in pencil and erase it, and it stays very up to date. I personally don't have one of them fancy little phones yet, but those of you who have the fancy little phones can keep it all right there. But whatever you do, keep up with who the right person to contact is. One of the things that Mike's doctors talk to us about is maintaining a log and records. It does save time, it saves money. If you're keeping up with your medications, your labs, your x-rays, your imaging, sometimes I've been neglectful in doing this at the beginning, and we'd go and they say, did you have an MRI of the thoracic spine? And my husband would be like, no. And I'm like, I think we did. Nah. So if you have it all written down, your insurance company's going to love you a whole lot more. And you won't have to duplicate your exposure to radiation and MRIs, particularly if you're as nervous with MRIs as somebody I know. So you don't want to have those done if you don't really have to. I'm sure, as like us, many of you probably go to multiple doctors at multiple centers in multiple cities and multiple states. So keeping a log allows us to have our things done in one city and keep up with it when we go to see other physicians in other places so that we're not duplicating things. One of the things you need to keep in mind if you're communicating about doctors and their medical appointments, be very, very aware of your tone and body language. I've worked in a doctor's office, and when people are sick, we oftentimes don't say things as nicely as we might when we feel well. So one of the things that you can really do is to try to pay attention to the fact that you may not feel well, but this person that you're dealing with is really trying to help you. So please try to remember to say please and thank you and make eye contact, and don't do that, you didn't do this for me and you didn't call this in and you didn't do what you were supposed to do. Ask those types of questions and assume the nicest thing rather than blaming. It'll get you a lot further in the long run. Again, come with a pre-prepared list, not only just the list of medications that you take, but the dosages, the numbers. If you need refills, I even included those unofficial things, which may or may not be legal. I'm not getting into what you do and what you don't, but be honest with your medical professional. Particularly if you're taking supplements of any kind that you may buy at GNC or at Walmart or off the internet. A lot of those things do interfere with your regular medications, as I'm sure you know by now. So. Also, not only the drugs themselves, but if they're effective. If they've tried a new antibiotic, or if they've tried a new sedative, or something for sleep, or something for pain, be prepared to explain to the physician how well it did or did not work. When you're coming with questions, I kind of skipped that one, I don't know how to get back to it there. When you come with questions, prioritize them. You want to make sure that at least you get those number one or two things that are really important. You want to get those out there first. Most likely, if you're only in the office for a 15-minute appointment, you may not get to everything, but you want to make sure you get to those one and two most important things. Also, doctors are sometimes called out. Good doctors have lots of other patients that they're taking care of too. And so they may only be able to spend 5 minutes with you instead of 15 because an emergency popped up. So you want to at least make sure that you get that top thing that was really most important to you, that you get that taken care of. Most hospitals, and I'm sure you know this by now, when you're talking about any sign or symptom, whether it's nausea or pain, they want it on some kind of scale from 0 to 10. I'm sure you're probably most familiar with that by now, or 0 to 5. So when you're just saying, oh, it's not any better, doc, or it's, it sucks, it's not any good, give it a number. It gives them a lot, doctors are science people, okay? They want facts, not just it's kind of a little bit better. It's too ambiguous for them. So, you need to really be specific with that when you're reporting information. Be very polite. I cannot stress this enough because I can't tell you how many times I've been yelled at by patients in doctors' offices. But be frank. Be honest with them as well. I know for a lot of you, getting up in the morning, you may be moving very slowly. You may be too fatigued in the morning. So if, 7:30, 8 o'clock appointments just will not work for you, then don't take an 8 o'clock appointment. Require that first one after lunch. Okay, you won't have to sit in the waiting room quite so long. Okay, that's usually one of the best ones. Another thing is state clearly what the appointment is needed for. Most doctor's appointments are 10 minutes, 15. If you're going to go talk for 30 minutes, then you're not going to get everything done because you're going to get rushed through your appointment. So if you're going to need a consultation, for example, where you're going to sit and talk and ask a lot of questions, you're newly diagnosed, you have many things to go over, then when you call the receptionist, ask for a consultation appointment. Okay, one of the things that my husband and I do, we always ask for the last one of the day. For some reason, because we now go to Dr. Glazer, and we go to Dr. Chatham, and we go to Dr. Henley, we go to these doctors, and we chat and chat and chat, and we talk about all kinds of things. So we have to be the last one of the day, or otherwise we'd never get out of there. He'd never get to see the next patient or something. So, but this is a very important, this is something that most people may not know, that they assume that every appointment's the same length. It's not. Okay, so ask for a consultation appointment if you're going to think you're going to need something longer than 15 or 10 minutes. If you're having financial problems, don't try to blow it off and fake them. Most of the physicians that we've worked with have been very willing to do what they can to help you with financial stuff, whether it's getting you on some kind of program to help you pay for your medications or helping you apply for disability or something like that. Most of them have been very upfront. They may waive certain fees, accept insurance only, not charge you or not give you the most expensive medication when they can give you something just as effective that's $4. So again, don't try to act Mr. Moneybags if this is something that's a problem for you. Another thing that I have found from working in a doctor's office is sometimes, you go to these doctor's offices and Miss Susie's smart pants up in the front just is not very nice, and she's consistently rude, and she's curt and sharp and short with you, and you just assume that the doctor knows because she's been working there for 2 years, so he must just put up with it. Maybe nobody else has complained or reported it. So if you come across somebody who is consistently not measuring up to how you think someone should be treating you, not your job to, dress them down yourself, but report it to your doctor or report it to the medical staff. So if there's a procedure or anybody that is not treating you correctly, speak up. Speak up for that. Some help when you are asking questions. One of the things that I have found, again, I don't know how my husband would have ever navigated this whole ECD thing if he hadn't had me with him. The words are too big. They're not understood. So I think it's very important that each of you have somebody with some kind of medical background that can be your voice to translate back and forth. It's interesting because we go to the doctor's offices and Mike, bless his heart, just kind of sits there and the doctor and I have conversations. And it kind of goes back like a tennis match. Okay, and he says something and the medicalese right back at him. And they're like, oh, wow, you know what you're talking about. You can use the right language. Yeah, okay. So it really is important that you either, as a patient, rehearse what you want to ask or rehearse what you want to say, or prepare that surrogate that's going to be representing you so that exactly what you want to get across gets across. And again, I suggest that you kind of rehearse this and practice it so you know that it comes across the way you want it to say. That way you get the information that you want and that you need and that you deserve. Again, speak up if you're asking for any type of other alternative sources. For example, my husband got physical therapy because we asked about it. He got massage because we asked about it. You can get dietary assistance because you ask for it. Again, most of the doctors that we go to are very kind, very helpful. They're wanting the best for us. But this is a give and take relationship. Maybe back in the 60s, maybe people used to go to doctors and just sit there like deaf mutes and not have anything to contribute. The doctor knew everything. Maybe that really was how it was. I don't think so. But I think with medical school now, most physicians are in more of a give and take relationship with patients. So if you're having trouble with eating or swallowing, ask for alternative assistance. If you're losing muscle function, having spasticity, having ataxia, ask for prescriptions for physical therapy and massage. Insurance might actually pay for it if it's written by the doctor. So don't just sit there and wait for him or her to, come up with all the good solutions. I've heard multiple times in the last 24 hours that the reason we're all here is because we're making it happen as patients and caregivers. We're the ones kind of driving this whole event. So do that with your doctor's office as well. If you're the caregiver, when you go to your doctor's office, make sure that they know what your role is. I'm the wife, I'm the caregiver. I'm the one with the medical language, I'm the one that you need to talk to. There are some medical offices that won't talk to you unless your patient signs something first. Thank you, HIPAA. So you need to make sure that you do that so that you can get the information. Bless my husband's heart, but if the doctor calls with lab reports, he doesn't have a clue what that means. Okay, so he writes it down and I interpret it or something. So make sure that they know what your role is and that you're kind of the go-to person. If you're the caregiver, also make sure you know as much about the diagnosis as you can find out. And that's where the website has been incredibly helpful. I don't read it every day. I don't read it every week. But every once in a while, I'll just get on here and see what's new and read some of the new things that are going on so I know what's happening. Also have very reasonable expectations for your patient that you're taking care of. Don't expect perhaps a 100% recovery. Don't expect anything that's not feasible, but do expect something that's positive. Another thing this is so real, but so difficult, that there's so much about healthcare and so much about your loved one that's going to frustrate you, and you just kind of want to take it out on whoever happens to be the nearest person. And so sometimes that nurse or that doctor that's really bending over backwards, or that pharmacist to help you, that's the one you kind of yell at sometimes. So please be aware of that tendency and try not to direct that frustration toward the wrong person. Okay. Be prepared, of course, when you call. I would suggest having something kind of written down as to what you want to say. I know being from the South, it's like, hey, how you doing, Nurse Becky? What's going on? How are your children? Oh, I'm fine, thanks. How are you? They don't have time for that, okay? As much as they might want to touch base with you, and you're a very important part of their day, you're only one part of their day. They're only one part of that 1 minute. So kind of cut out the crap and just get to the real, here's why I called today. I need called in, and it's prescription number, thank you very much, click. Okay? Get to the point and don't mess around too much. Also, doctors don't want to hear the long version. They don't have time for the long version. They want the Reader's Digest condensed version. And this is where I think it's helpful to have a family member who's a medical person too, because they can kind of cut out the crap and just get to the real stuff that the doctor needs to know. Oh, you went shopping at the mall. They don't care, okay? Tripped and fell, hurt myself. That's what they want to hear, okay? Not that you were smelling roses and all that kind of stuff. So, really get down to the nitty gritty. Respect that they are busy. Respect their busyness. That's self-explanatory. Okay. Be familiar with medicalese. Learn some basic Latin terms and phrases. I prepared, if anyone wants it. It's a two-sided document. One of them's got a lot of medical words on it that are very common. Excuse me, I'm now this old. But words like chronic, glossal, hepatic, lumbar, malignant, posterior, prone, pulmonary, renal. These are words that medical people throw out like Coca-Cola and Pepsi. Okay? These are just like normal words to us. For those of you who have no medical background, we may as well be speaking in Greek, because that's what this is, okay? Also, there's a lot of medical abbreviations that we use that PRN, you know what that means? NPO, know what that means? BM, bet you know that one. Okay, so there's a lot of these that you may know, some others that you may not, but I've prepared a list so you can kind of read prescriptions and see what they're trying to tell you, because it actually does make sense when you know what the little signs are if you can read them. Okay, so I did make, I think I only made like 30 copies of this, so like one per family. If you're interested, I will leave that back on the registration table or somewhere, if you're interested in those. Another thing, when your doctor starts having a conversation with you, make sure you have it in an appropriate location. They tell us this all the time when we're nursing people, but do not have conversations in bathrooms, in cafeterias, in elevators. Number one, it's disrespectful to everybody concerned. Number two, it's also kind of an invasion of privacy because anybody around can hear your business, and that's just not right. You deserve 5 minutes of one-on-one, uninterrupted, undistractable conversation. You're entitled to that. You should get that. So, if I can still remember one of my husband's surgeons just out in the middle of the hallway with all this noise going on, and that's one of the things that I would now do that I wouldn't do then. I didn't have the courage then. But excuse me, can we move this conversation to a quieter place with fewer distractions? Thank you. Okay? And then, only an idiot, I think, would ignore that. But, if the message comes from the internet, now this is some information that I got from one of my husband's doctors, that the one that actually diagnosed him. because I'm all the time taking in things from the internet, and doctors typically hate that. Well, I was reading this on the internet because they think it's a personal, like, you're not doing your job, so I was reading it on the internet. So there's a way you can word it that doesn't offend them. Okay, so that's what I'm going to share with you. First of all, don't be bringing in stacks of printouts. I read this. Here's copies. Go home and read this. Okay, that's insulting. Also, another thing, just because you've seen it on the internet, and you probably know this too, that doesn't mean you can believe it. Okay, stick to the reputable sites. When I'm teaching in school, one of my favorite sites is mayoclinic.com or .org. I think it's .com. Something that's very reliable. NIH, I go to them all the time. That's the stuff you can believe. If it's, Susie Q's comments about ECD, I may or may not believe that, okay, because I don't know who Susie Q is. But stick to the things that are reliable. One of the ways that Dr. Chatham said, I came across blah, blah, blah on the National Institute of Health website about something. Should we consider this? Okay, it's a nice way to word it. Or, what are your thoughts about the National Institute of Health's blah, 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 blah? Okay, just throwing something out. So those are the ways that you can pull them into your internet research without offending them, okay? Most doctors, and this is again coming from the physician himself who said this to me, if they're not familiar with what you're presenting, and most of the time they probably are, most medical professionals will take a minute, maybe not right then, take it home and email you or call you with their information after they've read it and give you their opinion. And we have found that to be true. Anything that I've read about the B12 stuff, we present that. Vitamin D stuff, we present that. And we get dialogue back instead of, you don't want that, but just some goofy stuff I found pictures of. Okay. The receiver. Please realize, and I think you have found this like we have, that most medical professionals are here to help you. I have been blown away, and I'm sorry that some of the doctors aren't still here to hear this, but maybe they'll watch the tape. But I've been blown away by these doctors who have traveled from all over the world to come share this information with us here. And I think it was Dr. Danya that said it, and I wrote it down. I'm not here to treat an MRI. I'm here to treat a patient. That blew me away. Because I know a whole lot of doctors that would just be like, well, the MRI says this, and that's what the biopsy says. So, in other words. So most of these guys are really here to help you and really want you to get better. Most medical schools now, and I had to research this because I didn't know this for sure, but most medical schools are now being trained in what is called shared decision making. If you sit there like a statue and go, whatever you think, doctor, then they're going to do whatever they think and will want to do because that's what you're giving them permission to do. If you have something to say, say it. If something is sitting in the back of your mind and I really want to ask this, but I'm afraid, ask it, okay? You got to grow some, okay? That's one of the things I wish I had done about 5 years ago that I'm a little bit better at now. But used to be like, well, I don't want to offend them and they're busy, so I just won't say it. And it cost my husband 40 pounds and 40 days in the hospital one time because I wouldn't do that. Okay, so you don't want that responsibility either. If the doctor or nurse says something to you that you do not clearly understand, ask them to repeat it. Just the other day when we were in Dr. Henley's office, they were changing some medications with his blood pressure, and I had Dr. Henley repeat it, and then I repeated it back to him. So in other words, you're saying we should stop the atenolol and increase the da-da-da-da twice a day, right? And I wrote it down. So did I hear you right when you said, is one way to say it, or I heard you say, blah, 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 is that correct? This is just making sure that what he or she is saying is what you heard. Okay. Another thing that I would love to share with you, and this would have saved him a lot of pain and aggravation as well. All hospitals now have to have a patient advocate. Use that. If there's something that you're not sure about, don't just politely ask, demand to see the patient advocate. Most of the times when we've been admitted to I always say that like I was in the hospital, but when he was admitted to the hospital, someone has come around that was like the nurse manager or the patient advocate or that big word ombudsman that I just never can seem to say correctly. But if they don't, ask the nurse in charge, ask the charge nurse or somebody to speak to the patient advocate. Sign no consent forms if you're not 100% sure about something. Please don't be polite, so polite that you don't speak up. I cannot stress this enough to you. Okay, so just store this away back in the brain somewhere. You know what? If there's just that little, I think this is probably the best thing, but that one little, okay, I'll go ahead and sign it anyway. Okay, don't. Please don't. If you have that little intuition that something's just not quite answered, get that answered. The case in point, my husband was put in the hospital and had surgery, which wound up being a totally unnecessary surgery. He didn't need it. But he had 38 staples. Is that right, honey? 38, like from here to here. And they put him in a patient that they put catheters actually into his jaw because he had such infection up in here and bags that were collecting the pus. Okay, they were in the same room, about as far from here as that table from me, sharing the same nurse, sharing the same sink, sharing the same bathroom. Stupid, right? Okay, my 10th graders that are in Health Science 1 know that's a dumb idea. Okay, I didn't speak up. I regret that every day. Every day. To say he got septic staph and lost 40 pounds and spent 40 extra days in the hospital is an understatement. Okay, because I just didn't want to pitch a scene. Okay, so when something like that happens, scream if you have to. Pitch a fit. Same hospital, patient care, pain management was underdone. I didn't speak up well enough then either. Okay, I was kind of afraid. So learn from me. Okay, speak up, scream. This is your loved one. Nobody's going to want them to be taken care of any better than you. Okay, so there is someone in that hospital that will take care of that for you. Okay? But having said that, I'm also a big, because I've been on the receiving end of this as well. But when you have that nurse, when you have that doctor, when you have that office that really goes above and beyond and really takes day-to-day good care of you, little thank you notes are free. It costs you nothing, and it means the world. I just know this as a teacher. If a kid writes me something, I'd rather get that than a box of chocolates, and I love chocolate. Okay, but just that word of kindness and a handwritten scrawl to me is everything. Bake cookies. If you quilt, make somebody a quilt. If you knit, make somebody a blanket. Okay, whatever you do that you can express. I've taken lunches to a doctor's office before, just homemade sandwiches. Okay, but just something like that expresses your appreciation. And it's amazing, when you're nice, you scratch my back, I scratch yours kind of thing. It's very important. Because remember, you're not their only patient. You may want to be, okay, but we don't think any of us are rich enough to have our own doctor that just takes care of us and walks around like we're the president or something. They do have other patients, and they're just as sick or sicker than you. So the fact that they do something that's really nice for them, just please don't let that go without expressing some gratitude for that. This is kind of probably should have been back when I was doing that other thing, but trust your instinct. This one I love. Trust your hunches. They're usually based on facts filed away just below the conscious level. So again, something just doesn't seem right that doctor said. A report that just doesn't quite seem like quite kosher. Speak up. Trust yourself. I'm a big instinctive person. I give myself a lot of credit for things like that. Just kind of, something just came to me, it just doesn't seem right. Ask. Get the gumption, which is a nice way of saying what I was trying to say a while ago. So if a treatment doesn't just feel right, it probably isn't. Likewise, if something sounds too good to be true, sometimes it still can be true. But if something is off, okay, trust those instincts, that little voice in the back of your head. Also, sadly, realize that many questions, particularly those that begin with the word why, your doctor will not be able to answer. There is no answer. So some questions don't have answers, or it may have answers, but it may not be the answer you want it to be. Okay, that's a fact of life as well. Okay, some of the roadblocks that are very commonly causing problems in communication with medical professionals is fear of asking that stupid question. I see this in high school, and I know many of you are way more mature than 10th grade, but sometimes we're not when we go to the doctor because we're just as afraid. But I see students in my class who and they're doing kind of like you, they're just learning medical stuff. And somebody will be brave enough to ask that stupid question. You can see other people going, yeah, I wanted to ask that too. Okay? So sometimes it just takes that one person to be brave enough to ask that stupid question, and there is no we know that, right? There is no stupid question, okay? You also may feel that doctors are too busy to handle my little problem. They're out there saving lives, and I'm just asking about how to pay for my medications. I just won't ask for that, okay? But that's what they're there for. You're paying them money to answer your questions. Many people also feel intimidated by doctors because they have more education, have a better car, drive a better boat, whatever. But that's not what they're there for. I mean, they are there to answer your questions. So don't feel so intimidated by that you can't. I've mentioned that before. If you have difficulties hearing and you don't take someone with you to hear, well, that's kind of foolish. So you do have to have some kind of plans yourself to dealing with obstacles so that you can communicate, okay? So make sure that you plan for that ahead of time. Don't leave that appointment with anything unanswered that needed to get answered. When worse comes to worse, if you continue getting care that you think is subpar, you don't deserve that, okay? You may need to switch doctors if that comes up. So don't be afraid to, you know what, this just isn't working for me. I need a copy of my records. We're going somewhere else, or getting a second opinion. Now, I did also ask some of the importance of keeping up with your own records, like when you've been to the hospital, maybe getting a copy of your records, or keeping your labs, or when you get those MRIs and those CT scans, keeping a report of them yourself. One of the things that we have found out, unfortunately, and this is at our hospital, is the hospitals are now being staffed with hospitalists. Has anybody come across those? I personally find that horrible. Not that anybody really asked, but so we go to the hospital when my husband has like pneumonia. And the hospitalist is there, for those who don't know, like your regular doctor doesn't come see you at the hospital. You're taken care of by this hospitalist. Their only job is to take care of people in the hospital. Sounds great. How many of them have heard of Erdheim Chester? You know the answer to that, right? What are they taking care of? The pneumonia. They're taking care of that isolated incident. They're not taking care of the whole patient. I find that horrible. But we're seeing that a lot. So the continuity of care that we've kind of grown to expect and deserve is sometimes not there. Also at hospitals, most of them now are 12-hour shifts, which is kind of nice for the nursing staff because that means they only have to work 3 days a week. But that also means that when you have Susie today as your nurse, you're probably not going to have her for the rest of the week, which means every day you're kind of breaking in somebody else. So again, you're not getting that continuity of care that when we used to work, 5 days a week or something, which can be an issue. Again, making sure that you have your own records, you avoid duplicated services. Again, I don't know of a single insurance company that wants to pay for one MRI, much less pay for the same one twice. So it can speed up your care and make everything much more efficient if you've kind of kept up. Like, no, we've already had that done. We had that done last week at such and such. Go get the records. Not like, well, okay, just do it again because I don't remember. Okay. One of the things that Dr. Chatham mentioned, too, when you get imaging studies, because we live in Florida and our doctor is in Alabama. So this is a problem for us. So he likes to get the written report from the MRIs and the CT scans as well as the pictures on the disc, because he might like the radiologist where we live, but then he might want to give the images to his own doctor to look at also. So they like to get the written report as well as the disc. Now, I don't know about where you live, but Vera Radiology, if we say we need a copy of his CT scan, she goes, okay, here it is, and it takes about that long. Okay, it's very quick. So let them tell you, oh, it takes 2 weeks, and you've got to wait, and blah, blah, blah. No, that's crap. Okay, I don't believe that either. He also suggests that when you get medical records that you arrange them chronologically with the newest in front or on top and then, farther back rather than the other way around. Otherwise, you're, flipping through pages to get to the current stuff. So put the current stuff at the front. The same thing with hospital stays and office visits. So if you have like special procedures like an upper endoscopy or a colonoscopy, or if you have a bronchoscopy, just keep a written record of when the most recent one of those was, or when you got immunizations and that kind of stuff, just keep up with it. Also, when you're observing your patient at home, and this is kind of more for your caregivers, you just kind of keep a little, not every day, but just kind of a running record of, if you're checking his blood pressure at home, or how is he sleeping, or how is his pain management, or how are the medications working out. Just keep up with that information, because that can also be used when you go to the doctor and when you communicate as well. I had some silly little, this is like teacher things that I would use here. And these are very obvious answers. Okay, so you can't really miss these. But despite taking her pain medications as prescribed, let's say that your spouse's pain level is unbearable. She is beyond miserable and you are frightened. Which one of these is the better answer? Doc, you're not taking proper care of my wife. She's screaming in pain. I demand to know what you're going to do about it now. That's not the good answer. Better would be, Doc, I know you're trying to help and we really appreciate your assistance, but that latest pain medicine is not controlling my Lucy's pain. She says her pain is a 9 out of 10. Whether or not she takes the medication, she's describing the pain as burning and stabbing. Great information, scientific, they can get that. Okay? You call Dr. Smith's office to speak to the nurse, Susan, about a concern. In the background, you can hear many loud voices. You get the impression that Susan isn't really hearing what you have to say. Hey, Susan, you there? Remember me, the person on the stinging phone? I guess I'm not as important as whatever is going on there. It sounds like having a party. Would you please give me your attention if you're not too busy, for me, that is. Okay? You may feel like saying that, but that's probably not the best thing to say. Perhaps it would be better to say it more like, Susan, it sounds as though this may be a bad time. Would you like to call me back? If so, when can I expect to hear from you? Or, our last one, an office conversation between a doctor and a patient. Doctor says, hey, Henry, how are you today? Henry says, well, Doc, I just don't feel right. Doc says, could you please be more specific? I don't know, I just feel bad. Henry, it's difficult for me to help you if you cannot tell me what exactly is wrong. I'm sorry, Doc, but I'm just so tired of being sick. Okay, which all may be very true, but it's not really helping Doc help Henry. Much better answer. Henry, well, Doc, my leg muscles have been too stiff for me to complete my morning stretches. My appetite's been poor, and I've lost weight. And I haven't been able to sleep more than 3 uninterrupted hours in the past 5 nights. Very concrete, specific information. The doctor can go, oh, I know what we can do, and has ideas for that. Does anyone have any questions? I'm done. I don't know who's supposed to speak next, so I can't introduce anybody. Yes, sir. Amen. Are you next, Ms. Baker? Okie dokie. Yay, I did it! Woo!